So
Hi.
here's your patient.
Hi, my name is Mirielle. I'm going to be helping you today. I'm going to diagnose you. It's really nice to meet you.
Wai sunanta Mirielle, she will be zata taimaka wajen duba lafiyanki. So yawa. So she's pleased to be with you. So you can go ahead and ask your questions.
Okay. So just tell me a little bit about yourself, like how old you are, what's your family status, do you have any people living with you, and what do you do as your job?
Wai tana tambaya, faɗa mata me sunanki, shekarunki nawa, ya kike zama a gidanki, sannan kuma kina da sana'a me sana'a.
Sunana Hafsa Hashim.
Shekaranki nawa?
45.
Kina zama kina da miji?
Ina da miji.
Me sana'anki?
Sai da mai.
Okay. All right. She said her name is Hafsat Hashim. She's a 45-year-old married lady. And she's happily married, has 8 kids. And she's a full-time housewife that does a petty business at home. She sells vegetable oils at home.
Okay. All right. And why are you here today? Like, what's not feeling well?
Wai mene ya faru kika zo asibiti yau, me yake damunki?
Zazzabi da ciwon kai da ciwon ciki da ciwon kirji.
Okay. She said she has been having this fever for about a week now with associated headache and generalized body pain and body weakness and abdominal pain.
And you said that her fever has been relatively consistent, no fluctuations.
Wai zazzabin yana zuwa ya dawo ne ko yana nan koyaushe?
Yana zuwa ya dawo.
Okay, ya fi yawa da yaushe?
Ya fi yawa kamar da yamma zuwa dare.
Okay, she said the fever has been intermittent. It is more during the evening hours and it is associated with chills and rigors occasionally.
Okay. What are your like other symptoms that you're feeling today? Like weakness or headache?
Wai me kuma yake damunki kaman ciwon jiki, rashin karfin jiki ko ciwon gabobi akwai?
Akwai sosai.
Okay, she said she actually has body weakness, generalized body pain, and joint pains. Okay.
Yes. And is anyone else in your family feeling ill today?
Wai akwai wani a gidanku da bai da lafiya, baya jin daɗi? She said no, she's the only one.
All right. And how's your appetite been? Have you been eating normally? And what kinds of things have you been eating in the past week?
Wai kamar ya cin abincinki ya ragu ne ko kuma yana nan kuma wai su me da me kika fi yawan ci kamar a satuttukan da suka wuce?
Abincin muke dai shinkafa tuwon masara.
Amma kuna sayan abinci a waje ne ko irin su awara ko irin su kosai su?
Ka sai awara ka. Amma ba ma sai kosai.
Okay, she said her appetite has been good and the staple diet mostly in the family is rice and maize gruel, and though sometimes they occasionally patronize local food vendors.
And would you say that you have any like shortness of breath? Is it hard to breathe sometimes?
You skipped for a bit. Can you come again, please?
Yes, I did see that. I was wondering if you've been experiencing any shortness of breath or like sore throat.
Okay, Mama. Wai kina jin kaman wuyan numfashi ne ko ciwon makogwaro?
nakan yi numfashi mai
Ah,
tsawo.
wuyan numfashi fa akwai wuyan numfashi ko babu? Okay, babu. Okay, she said she doesn't have any shortness of breath or sore throat.
Okay. So far, I think we're gonna try and do a blood culture and also test the hemoglobin levels, because I am a little concerned, because it doesn't sound like you're eating any like spinach, but also something that stood out to me was that you felt weak all over and that you were also having pains. So that's why I think we should test both of those. And Dr. Hamza, I wasn't sure if you've already done a blood culture. I would like to know the results.
Okay, we actually did some investigations. We have the blood film that showed 1+ of malaria parasite. We also have a complete blood count that showed hemoglobin levels of 13 gram per deciliter. We also did a Widal test that showed a significant titers for Salmonella typhi in her blood. Yeah, so those are the investigations we have.
Okay, so that was definitely something that stood out to me. Was I was definitely suspecting typhoid, especially when you said that there was like abdominal tenderness, and I think that the malaria definitely stood out as well. And I was just you know like thinking about like the headache and how it could affect any kind of just like tiredness or weakness. And from here, I think we're going to go with a treatment of probably, I would suggest a lot of water, like water, hydrate a lot. That's gonna really help you, and make sure that because Salmonella typhi is a bacteria that can come from uncleanliness, and it can be found on food that's not clean. Make sure that you're really sanitizing your area and making sure that you're practicing good hygiene skills. And I think for now, we're just going to focus on getting an antibiotic, like amoxicillin, because I think that's going to be the best option for you. And hydration, making sure that you're staying clean and cleaning down surfaces. I was wondering if you use a mosquito net at home when you're sleeping, or if any of the people in your household use a mosquito net.
Hello, can you hear me now? Okay, she said she sleeps under insecticide-treated mosquito nets at home.
Okay, so that's good. I was wondering if she also uses any kind of insect repellent during the daytime.
Okay, wai da rana kuna sa maganin sauro ne a gida?
Da rana ba mu sawa, sai da daddare.
Da rana ba kwa sawa. Okay. She said she uses insecticides, but usually it's at night. They don't usually use it during the daytime.
Okay, and has she noticed any like pockets of still water near her living area?
Okay, wai akwai kaman ruwa kwata haka.
A kofar gidanmu.
Yeah, they do have a stagnant gutter in front of their house.
Okay. So I would definitely continue using your mosquito net because that's going to prevent any bugs from getting in. And it's really, really, really good that you're using insect repellents. And for now, we're just going to stick with an antibiotic and just keep you on it for a while, probably like amoxicillin. If you're having headaches or any body aches, I think we're going to stick with some kind of painkiller, possibly aspirin or ibuprofen. And I think that's what we should do from here, and just make sure that you're really sanitizing and cleaning your area, because that can easily attract typhoid, salmonella. So just keep on sanitizing your area and having good hygiene. I think our final diagnosis would be probably a little bit of nutritional anemia, some typhoid fever, and a little bit of malaria as well. So just continue to make sure that you're really protecting your space by sanitizing, drinking lots of water, get some iron-rich foods in you, some spinach, some beans. I don't know if you eat meat, but if you eat meat, then some nice red meats are really good. I really stick to the spinach because it's a really easy option, and an iron supplement would really help with the anemia. And so far, that is what I have to say. Do you have any questions for me?
Mel, do you want to say something about the drugs you would use for the malaria? Because you didn't quite mention.
Oh, yes. So I would suggest taking an ACT with food morning and night, which is going to help get rid of it and balance out some levels, which is also going to help get you better.
Perfect. So I think you did wonderfully well, Mel. In the next second, I will switch the camera again, and you should be able to see each other and wave goodbye to your patient. Then I'm going to add 1 or 2 things, okay?
Yes.
Okay. Mama, bye-bye.
It was really, really nice to meet you, and I really hope you have a safe and healthy recovery.
Yeah.
I feel better.
All right, Mel, congratulations. I think you did wonderfully well. Just to add a few things, and in your diagnosis, you correctly diagnosed the patient to be having malaria and typhoid fever, okay? And you also added that she probably has nutritional anemia, okay? However, the hemoglobin levels is 13 gram per deciliter, which I think is within the normal range. So yeah, I think you can skip that anemia part, okay? And in addition, the choice of antibiotics for Salmonella typhi is good. Amoxicillin is good for it, but it's actually not the first line, okay? You can also things like ciprofloxacin, okay? Usually considered first line of treatment, but overall, I think you did wonderfully well, and congratulations. Okay?
Thank you so much. This was a great opportunity for me.
Yeah, you're welcome. You're welcome, Neil. It's always our pleasure.